Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Every 40 seconds, someone in the United States suffers a stroke, according to the Stroke Awareness Foundation. And thankfully, more and more people are surviving strokes. Sometimes they make remarkable, rapid recoveries, and we've shared some of those stories with you before. But stroke recovery typically isn't that easy. Today, we are meeting a stroke survivor who knows that recovery requires a lot of hard work, determination, and a lot of time. We'll also learn the importance of support, whether that's from family or in the community. And we'll ask how we can be there for our loved ones if they have a stroke. Joining us today is Jamie Lorping, who suffered a stroke, several strokes almost 3 years ago while she was in the hospital for a traumatic injury. She's going to tell us more about her road to recovery. So thank you for being with us today. Also, we have Dr. Greg Herman next to me, a physical medicine and rehab specialist, as well as the director of the outpatient stroke rehabilitation at the University of Kansas Health System. Good to have you.
Thanks for having me.
Yes, and also back with us is Jamie Johnson, a speech language pathologist who is helping Jamie with some speech therapy. So we're going to talk and dive into all of that. So thank you all for being here with this important conversation, because we talk a lot about stroke, but it doesn't just end with that diagnosis. It continues on. So previously we focused on the warning signs as well of stroke, the acronym Be Fast, and how to spot someone having a stroke. But Jamie, that doesn't really apply to your situation because you were already hospitalized when your strokes happened. This was back in 2021. You shared some photos from the day of an accident you had, this traumatic accident. Tell us about this. You were with your husband, your sons, you were enjoying some time at the lake, I understand?
Yes, yes. We were down at the lake fishing on our boat, and came back to the house to put the boat back, and our side-by-side got knocked into gear and started rolling down the hill, and I decided that I could try to stop this machine and jumped out of the truck and tried to stop it and got pinned in between the truck and the side-by-side. And I went into shock and had 2 collapsed lungs, 9 broken ribs, and had to be life flighted to the nearest trauma center.
I mean, just a freak accident.
Yeah.
And, you know, your instinct to jump out and try to stop something that's coming towards your family, your vehicle, it seemed like a natural instinct, not realizing what kind of damage that was going to cause.
Yes.
And you said shock. What do you remember from those moments and being life flighted? And
not a whole lot. I do remember laying there, hearing people, but not seeing anything, not opening my eyes, but hearing kind of the chaos that was going on around me. And I remember everything until I got into the helicopter, and then I don't remember anything else until waking up with the tube down my throat.
So, Dr. Herman, help us understand how strokes can occur after a traumatic injury or during a hospital stay.
Sure. Well, there's a number of different mechanisms that can lead to predisposition for stroke. Anytime we have trauma, it can injure not only our bones. If we have fractures, that can predispose us to developing strokes. We can have injury to our blood vessels that can cause clotting, and that can propagate and cause strokes in certain circumstances. So we also see patients that are really immobilized for a prolonged period of time. That too can lead to clotting of blood, and that clot can also propagate to the brain in unfortunate circumstances.
So Jamie may not have been predisposed or at high risk of a stroke, but it was the actual injury that happened that caused these strokes to happen.
That would be my concern with, or my thought, being an otherwise healthy young individual. That's most likely that was the case. It was the trauma itself that led the stroke to occur.
So you were in a hospital in Springfield. How long were you there? What was that time frame like?
I was there for 12 days in, ICU, and from there I went to Omaha, to the Madonna Rehab Center in Omaha.
So you go, we have some photos, I think, of when you graduated from Madonna. So how long were you there? What was that experience like?
I was at Madonna for 4 weeks, and it was a very vigorous program, I guess you could say. And day two started therapy 3 times. I went to speech therapy, occupational therapy, physical therapy, and 5 days a week.
So it was like a school.
It was
I heard
like a school.
It was hardcore.
It was hardcore.
Relearning to walk. I mean, that's back to
Yes.
basics. What did that work feel like? Was it frustrating? Were you hopeful? How did you find it within you to push through during that time?
To be honest, I wasn't very hopeful at that time. You know, being 40 years old at the time and having to relearn how to tie your shoes and just the everyday things that you, I guess you could say, take for granted that you can no longer do. And I'm primarily right-hand dominant, and it affected the right side. And so not being able to use your right hand, like I couldn't eat. I had to learn how to eat, you know, everything left-handed. So it was very frustrating at times.
So what was the rehab like to get your hands back doing the things that, like you said, we all take for granted?
Well, it's still not all the way back, but you know, just lots of rehab, lots of I don't know.
What was the hardest part of all of that?
The hardest part was just not being able to do the things that I've been able to do, you know, my whole life.
Walk.
And then walk, yes. And that was eat. That was my main goal when I got there, was I just want to walk again. I want to learn how to walk, I want to walk, and I want to drive my car.
I'm sure it makes you look at life completely different
Yes,
coming
it
out of that
definitely
place.
does, for sure.
So Madonna, it's not just an inpatient hospital. There are also skilled nursing facilities, nursing homes. Dr. Herman, after someone has a stroke, how do they determine where they go once they leave just a typical hospital?
Yeah, it's also new to patients and their families, this whole process, not just the acute stroke management, but also where you go afterwards. Here at the health system, I'm involved as a rehab physician, our therapists, our social workers, our acute medical treating teams. But it's difficult. It's difficult to conceptualize because as a young person, you're not thinking about going to the hospital, let alone a rehab facility afterwards. So, you know, we really want to get patients the most intensive rehab that they can tolerate and benefit from. We don't have as much research when it comes to stroke rehabilitation outcomes, at least as much as there is with regard to acute stroke interventions, but we do know that stroke patients in that particular population, they do better with aggressive neuro-specialized rehabilitation. We call acute inpatient rehab almost like a boot camp, so that you're busy, you're engaged, it's hard work.
She's like, yes, that's exactly what that was.
Good comparison.
Yeah,
Good comparison.
but
yeah,
that's,
not easy street.
In circumstances, almost all circumstances, patients who've had strokes who can tolerate and benefit from that intensive therapy, we want them to get the acute inpatient rehab.
So what would happen if someone just didn't want to go to rehab? What happens to a person? Why is it so important that they do some type of rehab and get to the right place?
Yeah, so we've actually, as some of the research, and a lot of it originated here, I'll mention it within our department. Dr. Randy Nudo is a PhD and had done some of the initial studies on what we call neuroplasticity, basically indicating that if we really push our rehab in that immediate post-stroke period, our brain can essentially rewire, reconnect different pathways and circuitry so that we can recover. And fortunately, I would say, not fortunate that you had a stroke, but fortunate you were young and you have more plasticity and you can recover more fully than older patients might be able to in certain circumstances.
How do you keep patients hopeful during this time?
Yeah, it's hard because it is a low moment, obviously, for a lot of folks. You know, we really try to involve families as much as possible. We want to know you as an individual, what your particular goals are. We have not just our therapists that are going to keep you engaged, but they work alongside you every day, so they can comment on the things that you might not notice, but might seem seemingly insignificant, but are actually big gains and big strides. We also will see patients that will come back to the unit, and other survivors that we try to connect patients with, to let folks know that this is just the first stage in a long recovery, as you can attest to, Jamie. And so we have to celebrate the small victories, knowing that the bigger victories will come.
How did you handle it mentally? You mentioned you weren't hopeful at first.
Right.
When did you kind of turn that around? And when you had those dark days, how'd you get through them?
It was hard. It was also COVID time. And so it was a limited amount of people that were able to come in to visit. You know, so many people at a time were able to come in the room. But it really got me through knowing it was a Monday through Friday, and my family, friends traveled up to see me. That really kind of pushed me through and got me through that week, was knowing that my family and friends were going to be there that weekend.
But it was tough. I mean, we haven't, it just seems like it's been a while since we've talked about the effect that COVID has on someone who's in the hospital, and unless you went through it,
Right.
it's hard to, it's hard to really connect with that. But I mean, you took that pretty hard.
Yes, it was tough not being able to see everybody, everybody in one day, or if I was having a down day, they couldn't come in. But it was definitely a challenge.
Are you still in pain today? And what are you still dealing with?
Yes, I still am in pain 24/7, from fingertips to the back shoulder blade. It's just a nonstop pain.
What type of pain? Like, give it a level of feeling, and have they told you that will go away over time?
No, I mean, nobody really knows the answer to that. I've tried several different things. I've been doing therapy, for the last couple years. I've been doing therapy. I've tried different medications, different injections, just, different types of things to try to get the pain to go away. So
it's an ongoing, as you mentioned, it's the beginning of many, many phases. How does somebody get involved with the stroke recovery registry here at the health system?
Yeah, so this is one of the benefits of working at an academic medical center, is that we have obviously a large research presence. And so if patients are interested in getting plugged into the newest trials or ongoing studies, then we can have them reach out. I believe the email may be on the screen here.
Yeah, you can email the Medical News Network.
For patients, and you can expect a call. It's a 45-minute or so phone screening to determine eligibility, but we have multiple trials running concurrently. I think that's something that we offer here at KU and academic medical centers generally that you might not find at a community hospital setting.
Let's bring in our other Jamie Johnson. Thank you for being so patient. You do speech therapy with Jamie. So tell us what it was like working with her particularly, and what you normally do with patients.
So when I saw Jamie for the first time, she's like 2-3 years out from her stroke. And you listen to her today and you think, you don't need speech therapy. So it was more fine-tuning. She'd had great therapy up to this point, and she was, wanting to fine-tune some of the things that she was still seeing from a cognitive and language standpoint. And those are the things that we've been working on.
What were you noticing language-wise? Something that, you're right, maybe someone listening to you wouldn't notice right away, but you certainly did.
Right. There's, like, you say right, but I think you mean left. I mean, just very simple things, I like directions, just simple instructions I struggle with. And being able to come up with words, being able to multitask, all of the things that I've done forever, just very hard to do and to concentrate.
And it's like, you've mentioned it so many times, just getting back to the basics, because before all this you were a mom, you're doing life, you've got 100 other things going on, and now it's like this has become your focus. What has that been like for you? Not easy, I hear.
It's been tough because, like you said, you know, pre-stroke, I was, and I still am, you know, a wife, a mom, a friend, all the things. And it's just been very hard because now I just feel like, oh, I'm Jamie with a stroke. And I'm trying really hard to try to figure out how to try to break away from that and be more just Jamie, like just Jamie, you know, just normal Jamie. And I don't see her very often, which is frustrating.
Yeah, Jamie Johnson, what do you make of that? Just hearing that, you know, becoming just your health issue becoming your identity, and how do you break away from that? What advice would you have for someone?
Well, it's interesting because we talked about that this week in therapy, and we talked about how at what point do you stop saying, oh, that's because of my stroke, and say, oh, that's because these are the mistakes, the word finding problems that my friends are having. I see them with, you know, coming up with names or difficulty coming up with names or words when you're at happy hour or at a boys' ball game or whatever. And so at what point do you stop saying, okay, I'm not going to say that anymore. I'm not going to blame it on that. But it's easy to, and rightfully so. And so then doing that fine tuning so that you don't feel like you have those issues and you're feeling like you're getting back to that normal Jamie.
Yeah, and bring that confidence back so she can be out in the world doing her thing.
Yes.
If you are watching live and have any questions about stroke or stroke recovery, you can use the chat on YouTube or Facebook. We are on the X platform, or you can email the Medical News Network. Information is there on your screen. Let's talk about support, because anybody recovering from anything, really, you can't do it alone. So Jamie, you told us that your husband Eric has been your rock. How has he supported you? How important has he been?
It's been, I mean, he's been there since day one. It's been very challenging for him and I both. You know, our world just got completely flipped upside down, you know, to where he's now you know, at that time he was being my full caretaker, which that was something that he, you know, hadn't done previous. Just basically just giving me a lot of patience, which is something I struggle with. But just lots of patience, and you know, just really being encouraging, and just being there, you know. I don't know.
Well, and you're the mom. I mean, it's hard to ask you're spearheading a lot of what happens in your family, in your house, and then you're asking your children, your two sons. Right. I think we have a photo of your very tall sons here.
Yes.
Tell us about them and just how important their role was in your recovery.
You know, just seeing them. I mean, just seeing them. That's really all that it was. I just wanted to see. You know, I just wanted to see them. Are they okay? I wanted them to know that I was okay, even though I really wasn't okay. But just
touch points throughout the day and the week to know that everyone's accounted for and doing well.
Yes.
Yeah, that makes a lot of sense. And support in the family is one thing, but what about out in the community? Other stroke survivors that you've met in support groups or just talked to in passing, how important is that?
I think it's really important. I just did a simple Google search and found the support group here at KU. And, you know, it's something that we do once a month, and I look forward to that meeting and going there and being able to talk to other people that are going through the same life as me. And it's just a total different, you know, than just talking to somebody that hasn't gone through the same struggles.
And the people who have not gone through it, do they treat you differently when someone finds out, you know, one of his friends finds out you've had a stroke, or one of your kids' parents finds out you've had a stroke? Do they approach you differently? What's that been like, or what have you felt?
No, I don't think so. I don't really feel like they do. But then it just kind of goes back to that identity thing. Like, they don't, but I do. It's always me that's like, oh gosh, they probably think this, or, you know. Got to
handle you with kid gloves and, you know, treat you differently because you've had this traumatic event.
Yes.
Not just the stroke, but the event, the accident that caused this in the first place. So do you feel like you're having to kind of share that story a lot? Have you gotten past that, or when somebody goes, what caused your stroke? And then you've got to go back and relive it all over again.
Yes. And and I'm happy to share, because if I could help one person, I mean, that's what I'm here for today. If I could, just help one person be hopeful that you can get better, that's just really my main goal. Is I'll tell my story wherever, whenever, just if it can help somebody.
Jamie, Dr. Herman, what's the biggest misconception about stroke recovery that you think is out there?
Yeah, well, I'll comment on this. It's not just for patients, but physicians as well. And I think it ties into research that's ongoing. So we've always thought historically stroke recovery essentially ends at a year. We see most of our functional gains in the first 3 to 6 months. What we're learning through newer research is that we can see patients benefit from rehab and even certain procedural interventions years down the road. So this is really exciting news for a lot of patients. There's a particular device that we're discussing amongst the health system here about implementing for recovery of fine motor function after stroke. It's called VivaStim, and can contact, again, the news network here to learn more about it. But we've seen patients with that particular intervention make significant strides in their rehab, as I mentioned, years after the stroke. And that's news to not only patients, but also physicians. Even as a rehab physician, since I started training to now, we're really making progress.
Research is paying off.
It is.
Jamie Johnson, what do you think, or maybe what do you wish people knew about stroke recovery from where you stand?
Jamie made a great point when she said she was surrounded. It takes a village. It took that family, it took friends, it took the support group to really support her and give her that hope to keep on and keep continuing to get better and better. Even though, like Dr. Herman said, we say a year, but it can be years that you still see improvement. So being able to seek that out, if you know that you're not back where you want to be, and there are things that you really are very motivated or more motivated, sometimes even than right after the stroke, to work on, then find that help. Find that therapy that will help you.
I like you said, fine-tune those things that you want to get better. If a family member or a friend has a stroke, how can we, as the supporters, do better? Is there anything that we should be aware of or do? I'll let you jump in, Jamie. Is there anything that we could learn from this?
I don't.
Dr. Herman, jump in. What you think? What
Yeah,
you got?
we really, we value that involvement early on, even during the acute phase of rehab. That first phase of rehab is really focused not only on the patient, but also trying to educate and teach families how to care for their loved one now that life has changed.
Yeah.
And then also patients. I know he had mentioned that's most prominently a concern for the patient because it's a struggle not being as self-reliant, but for family members as well, learning to care and be patient for their loved one as they go through a challenging time.
Jamie, any advice?
I just think it's amazing to watch her tell that story, and that she can help other people, that you're motivated to help other people. Because even having her sit in the lobby and watching her sit in the lobby, you would never guess that what she's gone through. And so to be able to tell her story and give that hope is great.
Well, let's get to a few questions from our viewers this morning. This is a good one. Stu wants to know, what's the difference between occupational therapy and physical therapy?
Go ahead.
Oh, okay. So, yeah, essentially physical therapy we think of as the therapists that are working with us on our gross mobility. So one simple way that we'll often describe it, physical therapy we'll think of waist and below. So how are we going to ambulate after a stroke? Occupational therapy we think of using our hands. You'd mentioned, Jamie, learning how to eat again, how to perform fine motor tasks like dressing, buttoning shirts, performing your daily routine with regard to hygiene and grooming. And so both of those therapy disciplines are very prominently involved in our acute rehab and outpatient rehab settings, in addition to, of course, speech language pathology, as Jamie can attest, both Jamies can attest to today.
Yes.
Yeah, for sure. Amy wants to know, how did the COVID pandemic complicate rehab timelines and availability?
Yeah, I know, Jamie, you had experienced this, but in the initial period of COVID, we didn't quite know what to expect with regard to exposing other patients to COVID. We pride ourselves in rehab as being very team focused. We have a lot of members that are involved in patient care. We have a therapy gym where we want patients to work side by side as they recover. And then also we had restrictions with regard to how many patient family members could visit. I think that was the biggest challenge that we saw across the healthcare landscape, and especially more so in rehab because family involvement is so paramount to a patient's recovery. Luckily, things have improved, but I know it was a challenge for you, Jamie, in your recovery period.
Yes.
Sharon has a question. Is there a way to get feeling back in the leg, foot, or arm? She dislikes the dead feeling, I can imagine. I would like to walk with a purpose again.
Yeah, so I will say when it comes to residual numbness or abnormal sensations, that is a tricky symptom to treat. We do have treatments that are effective for what we call neuropathic pain. Numbness, what we really try to focus on is retraining our brain to essentially interpret sensory pathways in a more physiologic and normal way. But I'll be honest, numbness is a very difficult symptom to remedy.
And wrapping up today, Jamie Johnson, what do you want the big takeaway to be when it comes to stroke recovery?
I like her talking about hope and not giving up and being positive and watching her tell her story without even getting emotional today. And so that hope is there and not giving up.
Jamie, what do you want people to take away from your story?
That you can make gains. I'm 3 years out and I am still making gains, 3 years out. And so I just don't want anybody to think that there's, like we talked about, that there's a timeline. There's no timeline. Also, I do want to talk about mental health. Since the stroke, I've been going to mental health therapy, which I think is a necessity because it just, like I said, flipped my whole life upside down. And I was just an emotional roller coaster. And so going to mental therapy has been a tremendous help for me and has made me hopeful and made me a more positive person, which I, tend to have struggled with in the past, always being negative, but it's made me hopeful and made me be a more positive person and get a support group. I think it's very important to find a support group. There's a really great one that I'm involved in at KU, and the American Stroke Foundation has been a good source as well.
Thank you so much for sharing your story today, and you're doing so well. We appreciate you. Dr.
Thank
Herman,
you.
what's the big takeaway today?
Yeah, I would just want to emphasize what you had mentioned regarding timeline. As I had said earlier, we're constantly learning new things about stroke recovery. No longer is it a scenario where, okay, you had a stroke and, best of luck. But we're evolving with regard to our understanding and treatments, and I think that should be, it should inspire hope amongst patients and physicians alike.
Thank you to all of our guests today. Thanks to our viewers for being with us. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update. Sometimes the best thing for a man's health is knowing when to ask for help. I'm Jessica Lovell on the next Morning Medical Update. Honoring Men's Health Month, I went out into the community to hear why some men keep health concerns to themselves, learn their biggest concerns and what keeps them up at night, plus the exams that can give men help before a problem occurs. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.